that's why I saw you. I will tell you how much I've spent thousands of dollars between chiropractors over the years, and I've been to many, and you just get frustrated. It's like you're wasting your money. So that's why I'm here, because I wanted that more in-depth, the more holistic chiropractic adjustment. Just because I'm constantly in pain, you know.
Where are you feeling pain?
So the pain is from mainly the scoliosis. Doesn't radiate into my legs. I have no focal neural deficits.
You already know the questions I'm going to ask.
There's a lot of the population that allopathic medicine doesn't have an answer to, which is, I went to orthopedics, say, oh, you're not a candidate for surgery. You can give corticosteroid shots. And you know that. And so, can I show you these x-rays?
Yes,
I'm really
show me. So, okay. It's just that an x-ray doesn't mean anything unless I have
this is going to mean to you.
History behind it.
And I'll tell you. So this is 2016, double curvature, 35 and 33. I just want you to focus on the numbers. I went in, that was before I started medical school. No, that was 2 years before medical school. I'm in pain, I want to do surgery. He's
pain
like,
where?
You're not a candidate.
Where pain in
right thoracic and left lumbar.
Okay, let me just process that a second. Right thoracic.
So my right shoulder blade, like kind of right up here. And then even when I bend over, you see I have a huge left hump, my right one as well.
It seems really compressed.
It is.
You just seem like you've been squashed.
Mm-hmm.
You know, like your organs and everything, like are really like just compressed here.
I went to the orthopedic. I showed him. He said
a degeneration there too.
He said, "Oh, there's nothing we can do about it. You shouldn't have pain. This, that, and the other. And if anything, you're gonna get worse 1 degree every single year. You're gonna get worse."
Ooh.
I said, "Okay."
1 degree
per year. That's what he said. At this, I was probably 21 or 22 at this stage. 2 years later, so I said, "Okay, thanks for nothing."
I'm still looking. Yeah, go ahead.
I said, "Thanks for nothing," and
This is an
orthopedic surgeon. Good guy, good surgeon. But I mean,
I got it. I'm just looking.
So I became obsessed. Okay, I'm so young. I need to figure something out. Started researching the theory of scoliosis. Like, what is it? Like, what is the study behind it? Or just trying to understand more. So exactly what you're saying, turning into the apex of the curve. Started doing hot yoga, like intense.
That's what we do.
Took everything I can learn off of the interwebs.
An account. Go ahead.
Did that for 2 years. When I started medical school, I thought my scoliosis was getting worse. I said, you know what? Let me go back to the same doctor to get repeat X-rays.
Okay.
And I was assuming it got worse.
Here's the second T11. All right, and you can see the rotation here.
Mm-hmm.
You can just see how that is just rotated. Because look at how it disappears compared to this side. How these are just much more visible. And then these, they're like, where are they? Where'd they go? That's that rotation there. See that? So you're not only are you laterally flexed, you're rotated this way.
Gotcha.
Okay, so I'm looking at this curve here. So that means I'm gonna have to pull you up and around the other way. I go the other way. Okay, fine. Go ahead.
This is 2016. Oh, nothing you can do about it. Well, guess what? I go in 2018.
Oh, much better.
You want to know what he says to me? He says, "Where'd you get the first X-rays from?" I was like, "You? When'd you get it done? 2 years ago." "Which doctor?" "You." "What'd you do? Did we do surgery?" "No." "What'd you do?" "Oh, remember the chiropractic stuff you said it didn't work?" "It did."
Oh.
And you know what he said to me? He was an older guy. He said, "I've been chiropractic orthopedic surgeon for 35. I've never seen something like this before." And I'm like, well, yeah, because you're telling patients that chiropractic or you have no other solution but brace. I'm past the age of bracing. I can't do surgery. And this was without. So you know what this tells me? This tells me that my mobility is still there because I've kept up in shape.
Yes.
And so I have hope, but I haven't been able to find.
You've even reversed some of your lipping and spurring there, the degeneration.
And mind you, I didn't know what I was doing was working. I was just doing it for pain relief, leading in the medicine ball.
So you were leaving the medicine ball.
Medicine ball was a huge thing. I would read sideways for 20 minutes.
Yeah. So who were you going to?
No one.
It was just yourself?
No, I went to the chiropractor. I got X-rays by him, but they wanted an insane amount of money, and I couldn't afford him.
I know.
He wanted $6,000 for 2 weeks.
Ooh!
Do this intensive
$6,000, dear Lord!
I couldn't afford it.
No.
And I was
nobody should be charging that much.
I couldn't afford it. So when I went there, I was very observant. Okay, what's the premise of this?
Smart.
It's not rocket science. It's just.
No.
Your back's turned this way, try to get it the other way. But the problem is my right thoracic...
I say that in my videos. I'm like, it's not rocket science. Yes, I have to go to school for 8 years just to understand it.
Right. But then
people are funny. They're like, oh, but rocket science isn't complicated either. I'm like, okay.
Manipulate or like lateralize the lumbar curvature. What I have trouble most is the thoracic, because I can't bend that, so I need someone else to do it for me. But
And you have a little minor, you are really zigzaggy all over the place. So you have a left up here, left up here, and then it switches over to the right over here, and then it switches back to the left over here, and then you have a tiny one over on the other side on the right.
And my cervical spine, I don't think this is going to show you. It's straight up and down.
So I first try to restore it in the upper neck, and then we gradually incorporate it into the lower neck. Little by little, we go down to C1, C2. Okay, C1, C2, C1, C2, C1, C2, C2, C3, C2, C3, C2, C3, C3, and then C3, C4, C4, C4. And you go between those two, and then eventually because C5, C6, as you know, is the most herniated region. So you go and try to put somebody an extension there right away, you'll pinch nerves. The IVF just closes too quickly because there's a disc in there. There's degeneration, stenosis, or whatever.
You don't have any sugar here, do you? Anything with sugar in it? I have it in my car, but my blood sugar is just dipping, so I was gonna. I have something in my car.
Go ahead.
Sorry.
I don't want you fainting on me.
Diabetic stuff.
I mean, we have those boba teas, 29
Beautiful.
grams.
Thank
I don't
you.
know how. You might want to shake it first. I don't know. Let me know how it tastes since I can't drink one.
Okay. Ooh.
Not good. 29 grams of sugar. Will that do it?
That'll be good.
We just then just kind of find a nice neutral position. Take a couple steps in place. Yep. And then go ahead and stop. So you just have a slight right foot flare.
If I bend forward.
Yeah, I do see that there. I mean, do you mind if I lift this up?
Yeah, I can take the shirt off.
Okay. So it's matching pretty much where the x-ray is. Are you okay like this? Mm-hmm. Here's that right side right here. Right there at the bottom. And it goes away. What do we say, T12 through T10. Here. There's that rotation. Okay, then come on up for me. And then you're going to turn this way. This is the one that I always do. Just go ahead and cross your arms in front of you. And then you're going to look back. And let me, good. Wow, you're flexible. See, you're flexible like.
I can go even more, which is.
I just want to watch here how this spasms. If you can hold it there, I'll really look at it. And then you can look straight. I got it now. It matches the x-ray, so it's.
Like the whole
Your
left side is
spasms,
higher.
yes, it's
elevation
nothing.
wise.
Now what I want to know is why. Oh, there! Look at that. There we go. See that rotation right there. So feel this versus this. See how that sinks in here, and then it's this switch the whole way down. Okay, let's see what he does over here. Oh my goodness. Too much?
No, you're good.
Okay, yeah, breathe. Yep, I usually just say place your hands on your stomach and just kind of participate in your own healing there. Chiropractors have very skinny little tables. So our center of gravity can go over the patient. Like that. I won't grab. That's it. It really doesn't like change over there. There you go. That's it. There's the bottom piece right here. That's the one right there. Excellent. That's it. Back to the knuckles again, okay?
Mm-hmm.
That's what I'm going to adjust right there.
Mm-hmm.
Any dizziness, vertigo, nausea when I'm doing this?
No.
I'm going to have to do this when you're on your stomach. It's
Yeah.
just... It's there. Okay, we're going to adjust it, okay?
Okay.
Oh. I gotta move the mic out of the way. I'm sorry. I gotta really lean into it. Oh, right here. Relax here. Perfect. That was all the way. Other side. Breathe. Oxygenate your blood. There you go. Here we go. So you see how I had to do that atlas in like 3 pieces on the right? And it all just went on the left?
Mm-hmm.
That's what I'm talking about, a right atlas up here. Does that make you okay?
Yeah, no.
Does that make a little more sense? You see how that left just went one
Yeah.
shot, and the right I had to go 1, 2, 3, and then we finally got all the pieces in. That's that inflammation up there on that right hand side.
Mm.
I was only on your upper neck.
Mm.
I didn't adjust anything down here. Right? That was all right there, these top pieces.
Gotcha.
That's your steering wheel. That's 50% of your range of motion. You get that moving, you're a miracle worker. Most people think, oh my God, because it's 50%. All right, now you're going to scoot yourself over just a little bit. Right there, we're going to do your toes. That tells me the other picture, okay?
Okay.
Good. Perfect. Ankle's a little stuck. Good. Whew. All right. Very carefully on this ankle. Any ankle problems that I should know about? Excellent. Perfect. Neat. Good. Any pain when I'm doing this in your low back?
Nope.
Good. Hip socket. Okay, I'm just going to pull. You will slide. Perfect. Excellent. No, you have excellent mobility. Come on up and see how the neck feels. I haven't taken care of the bottom piece, but just the atlas. See if you notice the difference.
Yeah, so it's easier to take to the left.
Okay, so all I did was take that top piece that was stuck this way and really took it around.
Yeah.
Like a dynamic stretch.
Mm-hmm.
Just boom, boom. And then people are like, oh, look.
Yeah.
Okay, because that's that. Now I haven't done much to the lower neck and the upper shoulders. That's where we have to go next. This is like almost the other 50%.
Gotcha.
This is, we call it the lid of the spine. You gotta get the lid on. Yep. Excellent. Not too much has changed when you're prone here. Sometimes people change, right, as soon as they get on the table. But this all looks the same. Any pain when I'm doing this?
No.
All right, just checking. Low back. How are you doing in here?
Definitely tighter.
This is where you wanted, right? This is what you wanted right here. I feel it. It feels mobile though, okay? I'm gonna do a test run on it. All right, I'm just gonna see how easy it is to move these, okay? So you're gonna take a deep breath in. On the exhale, let it all the way out. Good. Pretty mobile, okay? I think you're gonna be okay. I'm gonna do those upper ribs for you, okay? I got the mic here. So take a deep breath in. Excellent. Is that okay?
Yeah.
Coming in here and pushing against that curve. And again. Good. I gotta come around the other side. Excellent. He curves all over. And again. Excellent. Okay, I'm going to pull at the low back here, just the skin. How was that? Are you okay?
Yeah.
No, there's no adhesions. You know, the skin is gliding. Just, I view this profession as like another tool in your pocket, you know?
Well, I appreciate you because there's a lot that you do that modern medicine can't, so.
What is it called? Integrative medicine?
Yep.
They just found it was a bunch of myoglobin and inflammatory markers. The more inflamed you are, the more comes to the surface. Because my patients that come in like 4 months, they have nothing comes out in the back. I don't even do gua sha, there's no point. It's called Kurokan in India. It's got a lot of different names. I can't remember the Russian name. Coining, you know, they have different names for it. You're just trying to get circulation in there. Like you said, trying to keep your spine moving. But it takes another human putting pressure into another human.
Yeah, that's why it's...
Because it's too much fine motor skills for a machine to do it.
Mm-hmm.
We haven't come up with the technology yet. Maybe one day. Probably take another 100 years.
Yeah, we got to keep you in business. So.
I don't know how long it would take, you know, for a machine to do this kind of detailed work. To be able to scan the body, right? You got to scan it our way. And be able to put the right pressure, adjust the pressure constantly. I don't know. Sure, it can be done. You know, people are always like, oh, you're in the business. No, I'm really in the business of people being able to help themselves. I was never in the business of cranking people in and out. Okay, that was never my motto or my business model. Sorry. I told you. Here we go. It's that T7 to T4 on the right-hand side. Here we go. Real sore. Here's the switch, okay? Right, we were left, left, left. Now here's the switch. You saw it on the x-ray. See how it's just always more tender on that convexity. Here's the concavity. Here's the convexity. It's rib heads full of nerve endings. Dorsal root. Is it dorsal ramus?
Mm-hmm.
Skin on the back and the joints. How are you doing? This is a bad one.
Yep.
Okay, let's just, you ready to just get rid of this thing as much as we can in one shot? All right, there's about 1, 2, 3, 4 here. I'm gonna go down each one 5 times. So here we go. Breathe. Deep breath in. Here we go. And then here we go on the exhale. 5, 4, 3, 2, and 1. Down. Again. 5, 4, 3, 2, and 1. Breathe. 5, 4. I'm gonna hold on to it. 3, 2, 1. Okay. Take a break. Those are hard to get yourself. That's it. Okay. Time to put the lid back on. Here we go. I'm going to be pushing down superior to inferior on T1, okay? Right here in this little gutter here. I know, there he is. Wiggle, wiggle, wiggle. Come on, come on, come on. There's your problem right there. That's just all compensating from that top atlas. Too much? I'll back off, I'll back off. Is it going down your arm at all?
Nope. No, you're good.
Okay. We know where they live. We're so mean. breathe. I'll work with you. Let's hold that down. Hold that one in. Come on. Okay, perfect. Take a break. We're going to go down to T2, T3 on the right, okay? There it is. There we go. Okay. There we go. We're gonna get the iliac crest. Here we go. Cluneal nerves. Lovely. There you go. SI joint. Right there. Does that hurt?
Yeah.
Yeah.
Very tender.
What's going on with the SI joint? All right. That's why I said no new stuff. Give it a week to settle in. It's okay. You just got to go through this once in a while. The first time's always the worst. Perfect. Okay, I'm going to go up the SI joint. Here we go. Very good. Excellent. Other side. This side shouldn't be as bad, okay? Okay, got it. Just get it. Okay, so this is cold, all right? This is a little cold. It starts out cold and then it gets warmer as we go on. Okay?
Okay.
I'm going to really try to break down that left side here. Ooh.
Is that ribs or is that spasm?
Yeah, it's ribs. A little bit of scar tissue there. Perfect, okay. Now, this next one isn't too great. Both arms behind your back. Okay, yep, good. Here we go. Okay, take a deep breath. I'm gonna go right underneath the scapula here, both sides, 3 times. 1, 2, 3. Arm up and over, good. Do the inferior spinatus, yep. Inferior spinatus. Get that little lovely nerve right there. All right, good. Just giving you more shoulder mobility by releasing the scapula wall here from the wall of the thoracic. Oh my. Okay. There we go. And right there. Almost done with all the hard stuff. Okay. Whew. You can relax. That was all the hard stuff right there. So I'm going to place some more oil on you, all right?
Okay.
It's just so that I don't get too much skin abrasion. Okay. Woo! Nice and hot. Got blood rushing. Good. That's the scraping.
Gotcha.
Now what is going on with these ribs? Let's find out. Oh yeah, look at you. You were right. Ribs. So what I'm going to have have you do is actually open this up, because this side's being compressed. So you're gonna give me this arm and you're gonna go, oh, that popped. All right, and look up for me off the table. Don't worry about the face paper. You're gonna come up over to the side, look down here. That's it. We're gonna open this up. So yeah, you gotta put the roller right here. Push it, yeah.
Gotcha.
I'm gonna open this up for you. That's it. Look at that ribs there. You got about 3 of them. Turn this down a little bit. Like open. That's it. Now I can get in there. Oh my goodness. How far does he have it? Sorry, does that hurt a little bit?
No.
Let me take some pressure off of it. Just gonna bruise.
No, you're fine.
There we go.
I always thought my left was worse. I'm surprised how much is on my right.
Yeah. It's all over
It's
here.
always backwards these things, right?
So
Like you feel it in your
not
left,
always. But you might be cleaning this out yourself. Like
but
working
I'm
on your
neglecting
left.
my right.
Maybe. That's what it kind of looks like to me.
Really?
Like the skin is kind of glued
Really?
here. Where it looks like you...
I always have the pain on the left. I never
understand.
really like.
It's okay.
Yeah, I don't know.
You gotta open this side up. Yeah. It is what it is.
I know, right?
It's okay. That's what I'm here for, to find the stuff that... I mean, it's very clear. If we took... You can come back down again. I'm gonna show them a picture of it.
Oh, wow.
So you see how that all kind of came out over there? And there's nothing over here.
Huh.
Now I'm gonna check the upper.
Yeah.
But this is... It feels like it's kind of glued. It's not as well, it's fine now. It's just, when we first started, I was like, oh! Oh, now plenty of bruising is coming out over here. Okay. On this upper part here, I mean, you got plenty. That's pretty raw. Does this hurt?
No.
Burn? You okay?
I'm in pain so much. I'm
Oh.
here for like the.
Okay. I'm really pushing on you too. Okay, tuck your chin for me. Woo. To me, the neck and the glutes were the sorest regions. On you. Now, it is bruised, okay?
No, yeah.
In this upper back, we'll show you in a second, but it is there. I'm gonna go do some infraspinatus over here, and that's about it. And up, yeah, just like there. Because if you stretch and elongate the muscles, that's the trick. You get more out. Okay. Hand can come down. I'm gonna wipe you off, all right? Sop up some of the oil here. Nice exfoliating treatment. Exfoliate all the skin cells on your head. Oh, it looks much better. Much better. Now, I'm not talking about the bruising, but the spasms. Oh, it looks so good. I mean, looks
Better.
so much better. Yeah. You just needed a cleaning in a couple days. Probably by tomorrow, if you take a picture of your back, you'll see the difference. You'll notice, like, you can see more of the definition of your muscles in your back. We can put the shirt back on. Take your time coming up. You're gonna, oh, sorry. You're gonna be a little sore. You may be. You okay? How you feeling? I just did the back. You okay? All right. Do you want mild, medium, or?
Oh, you can give it to me.
I'm gonna start halfway.
Sure.
How's it feel?
So,
All right.
yeah. I think I'm gonna feel it probably more in the next couple of days.
Well, Yeah, because you feel good and then it starts to settle in about an hour.
Yeah.
You start going, ooh. You okay?
Yeah, no, I feel good.
All right. So for the Y strap, what you do is you sit here and you hang your legs off the table.
Mm-hmm.
Okay. So I try it the lightest way and then we gradually work you up. Does that kind of make sense?
Yeah.
Feel the pull?
Mm-hmm.
Okay, that was about medium there. Okay.
Wow. Haven't had that one done in a while.
Takes your breath away.
Yeah, it was a lot tighter than I remember.
You're pretty.
Probably because I haven't done it it's been a year since I've had it done.
Did you feel it go down into the low back?
No, but I used to.
Yeah, so, some people are like, I want it all the way down to the butt. If you came back in and they held the legs, it would go all the way down.
Right.
I just don't want to do that if you feel like that was a little much. You know what I mean?
It felt pretty tight on the right side more than the left. But when I've had it done before, I would feel it all the way down. But I was getting adjusted like a couple
lot.
Yeah.
Right. So the first time it's kind of like,
yeah.
we do like a medium one. Like that was medium force right there.
No, yeah. I think that was good for right now.
But I don't want to tear things.
Yeah. No.
I'd rather just let it kind of go whatever it wants to do, okay?
Yeah.
You feel it in there?
Well, I was like, this rib always kind of comes out, so
Okay.
I try to feel it like how it.
Good. Well, what we're going to do is another stretch.
Okay.
Let's start you out with mine
Okay.
first, and if you're like, okay, I need more, I just wrung you out. Let's do this one first.
Okay.
Have a seat here and face that wall. But let's start out. Now, is that centered?
It's kind of hard to.
You'll feel like one bump on each side of the spine.
Yeah.
More or less. I know you got.
Yeah.
Okay, bend your knees. You're going to go all head back towards the ground. Yep. Now find a place that's tight, but don't go into the lumbar spine. Stay in the thoracic spine. Find a spot that's tight. Generally, probably around T7. It's going to be like right between your shoulder blades, right there.
Yeah.
Now, bring your arms up and over. Give it a deeper stretch. Push. There you go. Let's start you here, okay? Are you okay?
Yeah.
And you can move it around. Like it's been about 2 minutes there, so you can move it up higher until eventually it just won't kind of go any higher. Get the hump, the back of the neck. They make stuff like this, but it doesn't have the height. It's like too small. And I'm not like, okay, how are we gonna get off of it? No. Back. Now, roll to the side.
Oh.
That's it.
Okay.
There you go. Done. Took me a very long time to make that.
Yeah.
Let's see. When you place a fulcrum in the thoracic spine is, would you agree, is more rigid than the lumbar spine? Thoracic spine has 12 sets of ribs. Lumbar spine has no ribs. What do we use to strengthen our lumbar spine? Our core. Because we simply don't have the bone down there. So why would I put more motion into a piece that's already mobile? Why would I do that? Pelvis is bulky, rib cage is bulky. Where does everybody have pain? Here. The part that's wobbling around and irritated. So I'm not going to go put motion in there. So I'm going to place the fulcrum up higher. As my butt hits the ground, I create a curve in the lumbar spine, creating the lordosis in the lumbar spine. Does that make sense?
Oh, we want lordosis?
We want the lordosis in the lumbar spine, right? I want to reduce the kyphosis in the thoracic spine, and I'm creating a lordosis by my butt being on the ground. As soon as if I go too low, what happens? My butt starts to lift, and I start jamming facets.
So you kind of keep it in the
I
thoracic.
do not put it in the low back. Up here,
So
get up there.
Higher always better?
Higher always better, yes.
Because it does make sense, because you kind of introduce the normal curvature that...
You got it. Just as soon as you see it, you get it. So you're saying that...
Most people, I don't know, it was very abbreviated, it was very just like, give me your money and leave, like type thing.
On the neck?
Just in general, the whole visit, I mean, you never felt like anyone cared enough, so...
Oh,
Yeah.
well,
So thank
no,
you.
no. We be caring here.